Welcome to Reflections in Veterinary Education. Today we have a special guest joining us, Dr. Kristin. I'm sorry, I forgot to ask you how to pronounce your last name.
Chaney.
Chaney. Okay, just like it looks. Dr. Kristin Chaney is going to join us to talk about her experience and perspective with veterinary education and some kind of interesting things that she is working on and thinking about right now. But first of all, I guess we should do our introductions. I'm Eric Hoffmeister. I'm an anesthesiologist at Auburn University. And Catherine?
I am Catherine Fogelberg. I'm the Associate Dean for Professional Programs at Virginia Tech.
And Bobby?
And I'm Bobby Connor. I'm a criticalist at Virginia Tech. Small animal.
And Kristin, just a quick hello.
All right. Hello, everyone. I'm Kristin Chaney. I am actually an equine internist and criticalist. I'm at Texas A&M.
Excellent. Welcome. Well, to start off with, Catherine, I believe you suggested that we invite Kristin for our first ever guest recording. So just share with us a little bit about what brought you to that idea.
Sure. Well, I'm glad my co-hosts have better memories than I do, but no, honestly, it's an honor to have Kristin as our first guest. So the main reason I was thinking she'd be great is because she was an instrumental member of the team that started the competency-based veterinary education movement within veterinary education. But also I had the pleasure of meeting her at VEC not too long ago in person, and she's just a lovely person and very passionate about education. So I thought she'd be a great guest.
Awesome. Great. Wonderful. Thank you. Well, Kristin, why don't you tell us a little bit about what your earliest teaching experience is that you could remember?
All right. Well, first of all, I just want to tell the team, thank you so much for having me on. It's quite an honor to be part of this first inaugural podcast as your guest, and I'm excited to be here. So my earliest teaching experience, gosh, I don't really remember ever learning to teach or wanting to teach, but I had some really great teachers when I was growing up. And my first memory of a great teacher was my first grade teacher who used to read books to us. And I can still remember sitting around, her knees, and she's reading a book. And I had another teacher in fifth grade that read stories, but then she also translated those stories into the work that we were supposed to be doing. And I thought, isn't that neat that you can tell a story as you're supposed to be doing work? And so I think I gravitated towards history when I was in college. And in fact, truth be known, I'm a military history major from the University of North Carolina at Chapel Hill. And yeah, much to my parents' dismay, what do you do with a military history major? Well, like any good Southern girl, I ran to Colorado and when I graduated from college, and I went to work on a dude ranch. And so this kind of does come back. It does circle back, I guess, to my earliest memory.
I don't care if it doesn't. This is super cool.
Yeah, well, agreed.
this is my wayward life. But I went to Colorado, and I worked on a dude ranch, and we had about 180 horses or so. And it was a really, really nice place. It was a 5-star, 5-diamond resort at the time. This is in the early 90s. And I just couldn't wait to get there. I had grown up in pony club, riding and I guess teaching others the things that I was learning, in pony club, because you had a lot of opportunities to go to different competitions and even knowledge competitions. And so I loved that. Well, when I got to the ranch, fell in love with the place, of course. And I ended up teaching riding to folks that would come out and stay for the week. But then interestingly enough, I didn't really know how to ski. But in the wintertime, so this was, mind you, supposed to be a summer job. I never left. I stayed for 7 years, year round. And again, much to my parents' dismay. But I ended up teaching cross-country skiing. And I had never cross-country skied before, but I think, just that whole, I think teaching yourself history and writing about history and learning things on your own and then translating it in your mind into a story that you could tell was the same to me as being a teacher. And so I taught cross-country ski lessons to obviously beginners, but had an absolute ball. And so that was my life for quite a few years until I really got involved in the equine program then. And we had to vaccinate all of our horses. We dewormed all of our horses. I helped get a dental health plan going. This was, back in the early 90s, there weren't a lot of people that were using dental health as part of preventive care. And so we started that. We had a really proactive dentist, veterinarian in town. And I just learned so much about first aid and care, and actually about mental health in horses too. We were able to take those horses to and from pasture every day. Even within this herd of 180, we had small cliques that ranged from 2 horses to 11 horses, and in any group number in between. And it was just phenomenal to follow and watch the sociology. And I finally, every time I would leave for any length of time, I would just sob. I just couldn't stand the thought of leaving them. And so finally, I started thinking that, I'm continuing to ask questions of the veterinarian, what about this? And what do you think about this? And he's like, you need to go to vet school. And I'm like, look, dude, I'm going to tell you, there's one thing I can't do, and that's science and math. I proved that pretty well when I was in college. And he said, listen, if you really want to do this, you can do anything you put your mind to. And so I ended up going to vet school, and I went to Colorado State, and that was a really great experience for me. So I think, all of those things lined up together. Just, I think I've always gravitated towards telling a story. And to me, that's what made some of my best teaching experiences when I was growing up, and people that I really wanted to emulate.
Oh, I love that. The funny thing when you talk about telling a story, because the 3 of us have spoken before, and I don't think any of us were like, we're going to go and teach, right? But when you talk about the storytelling, that really resonates, because that's actually one of the things I love about medicine too, is I love, you get a patient that comes in and you've got these symptoms. And I like to share that it's like picking up a book at like various stages. Like you're open at, this could be chapter 7, and I have to figure out like what the ending is going to, and I feel like a little bit of a detective, but I have to write a story that makes sense, right? Like nobody's going to be satisfied if at the end you're like, it was all a dream. Like it has to be logical. And so that storytelling, when you mentioned that just really resonates, from both the teaching standpoint, but also from the veterinary medicine standpoint. There is a lot of storytelling in that as well. That's awesome, Kristin. I didn't know any of that about it. That's so cool.
Yeah.
So do you still go back to this Dude Ranch ever, or does it still exist?
It does exist, actually. It's just outside of Granby, Colorado, and they had a terrible fire up there. I don't think it was last summer, maybe the summer before, but I can't say the original barn, but the barn that was the second barn, that was built in 1948 burned. And it was just one of the, hallmarks of this very, very, very beautiful ranch. But they were able to relocate all of the horses before the fire reached. And, everyone was safe in that regard. But I do get back every once in a while, and there are very, very, actually, I don't think there are any horses left there now. That were there when I was there, but for many years there were, and occasionally I would see things that were posted online, and I would be able to, pick out some of my old friends, and oh man, they were just like family to me. And I knew their different sounds. I just knew their different voices, and I honestly lived, breathed, and slept everything about that herd. And it taught me so much about working with horses and watching them move, and just watching them be together and how they interpret things around them. So it was just really, it was such an immersive experience. And, that's actually where I also met Buck Brannaman, and really started working with him. And he's one of the sort of the founding fathers of this natural horsemanship thing. And I was able to translate that to different things in my life as well. So I just, I'm so grateful to Colorado for so many things, but that was one of them for, making me, I think, a healthier, better person. And part of it was meeting those horses and having the experience of being with them in that capacity. And I'll just also living that life of, exploration and sort of finding yourself. I was a very late bloomer in my career, to be honest, because, I had graduated. Actually, I graduated. This is a true story too. I graduated from vet school 10 years to the day that I graduated from college.
Wow.
So, I was not one of those people that went straight through. So I really had some, I had a lot of growing up to do, I guess, in my own mind.
Oh, but what a great experience.
Yeah, it was.
I can hear just in how you tell it too, how important that was. That's amazing. Very cool.
Yeah, I just to interject a little bit here. So number one, I actually was raised in Colorado, so I'm very familiar with the state.
Oh.
I did better when I left the state, but that's mostly because my family's still there. But just as Bobby said, the idea of storytelling is, I never really thought of veterinary medicine or a case as a story, but it is in a way. And so I think that's a really fun thing to take away. But I'm also at heart, I'm a storyteller, and that's why I do qualitative research, because it's like you discovered you can like tell a story and it can still be rigorous research, and wow, that's pretty cool. So I love that you brought that out, and I love that you're a late bloomer. I didn't go to vet school until later in my life either. So I think that's really wonderful. So thank you for sharing that. That was amazing.
Yeah.
So Kristin, it sounds like you had these experiences in a teaching role. And then when did you kind of come around to the idea of like, oh, I want to be an educator, that I want to make this a part of my life and profession?
Oh gosh. Well, it was a little bit, sometimes things happen and doors open, and you never expected that door to be there. And I think for me, this was one of those opportunities where there was a door presented, and I never in my life dreamed that I would walk through this door. But I was in the process of transitioning from Michigan State University, which is where I had done my residency training, and I had been a fellow there, and loved my colleagues, but really felt like to really experience my true self and everything that I felt like I could be as a clinician, I really needed to move and be somewhere else where I could really spread my wings, and had their full support all of the way. But this was just something internally I felt. And this was in 2008. And at the time, it was very difficult to find a job as an equine criticalist where I could cut and do surgery, because I was also an internist. And, really, you needed to be a surgeon to be able to cut. And even though that's what I had been doing for 6 years, it was a very challenging thing to find that job that I wanted. And so I got a little bit, kind of uh, reflective about, well, gosh, what really does my life look like? Do I need to find another academic job? Now, mind you, this is 2008. So what's ahead in 2009 and 10, that was the massive economic downturn. So in the fall of 2008, a colleague of mine at Michigan State said, hey, you know, she was a food animal internist. She said, I hear that this place called St. George's University is hiring folks. And I was like, where's that? And she said, well, it's in the Caribbean. I was like, no, and we're not doing that. No, you can't. Really? And she's like, listen, I've talked to a friend of mine who's been down there. She says this is a really wonderful place. So to make a long story short, we both went to work there, and we went together, and it was part of their push for accreditation. And so we started our jobs in late 2008 there, and essentially had to make a decision about giving up clinical work to go and be something totally different, and talk about a different kind of storyteller now.
Yeah.
Because I'm not going to have a clinical patient to teach with. I'm going to have my brain, and I'm going to have to bring to life nothing but anatomy and physiology to these students. And yet here I am, I crave these really complicated, disastrous emergencies, the bloodier, the crazier, the nuttier, I just give me more. And so it was a challenge, but it was also something like a door that I never dreamed would present itself to me. So we went and immediately started getting involved in their curriculum redesign that was going on. We started developing courses, and it was just amazing the amount of responsibility that she and I both had as very junior faculty member straight away. And so just the planning of all of these courses that were going to be our sole responsibility as the two primary large animal people there, it was a lot. And so it was day and night. There was very little sleep. This is when everybody was still Skyping. We were Skyping in the middle of the night, planning experiential learning opportunities for these students. And, God, it was the most creative time of my life. And I just thrived on it. And, when you've got a colleague that's like-minded, man, it's just the sky's the limit in what you can create if you're passionate and excited about what it is that you love. And just translating all of that into preclinical learning was a fantastic opportunity for us. So that was sort of my transition from having, clinical cases to talk about with students, which, I mean, let's face it, when you're on clinics in an academic setting, you have so many things that you're juggling. You have not just the patient and the students, but you've got interns, residents, you've got the clients, you've got, all of these other service responsibilities. You've just got all of these things. And there are so many other pulls. And yet when you get into a situation like we were thrust into, it was really beautiful because all we had was the curriculum and the students, and it was just, I mean, it was phenomenal. And I just couldn't get enough of it. We had an absolute ball, and that, I think it couldn't have gone better for me to have that kind of experience be my first kind of foray now into teaching. Now, you all know we don't get any training on how to do any of this. And all of a sudden I realized, wait, a syllabus? Oh my God, I've got to have a syllabus. Well, how do I get a syllabus? What does this look like? And so you just, thank heavens for the internet, and you've got your colleagues, and they're just like, sending you so much stuff. And I had all kinds of jump drives and this and that and the other. And so it was a lot of it was cobbled together initially, but you take what you get, you give credit where you can, and you're just so grateful for having support and supportive colleagues, and mentors, and I still am to this day, because they actually, I think, gave me the confidence to go and do something that I never ever probably would have dreamed that I was going to do. And the comment was, you can always come back to clinical medicine, but you may not ever get this kind of opportunity again. So it was a door that I really felt like I needed to go through.
That's amazing.
That's awesome. I do want to just put out there that I just wrote a chapter on syllabus. So
Oh,
you need any
bless
additional
you.
guidance now that you've been doing this for 15 years.
Hey, I will probably still read it, Catherine.
Right? That's too funny. So, okay, this is like a side question, because this is something I, think about, how you were worried about leaving clinical medicine. And it sounds like that was, did you not miss that part of it? Or was it, I'm sure you missed it, but it was, there was enough keeping you busy that it wasn't problematic? Because I worry about that, not going to lie.
Yeah. Well, I got to tell you, there was part of me that ached to have that adrenaline rush.
Yeah.
But this other excitement of designing and creating really overtook. And I have just a wonderful mentor, Sue Holcomb, who would call me about cases and tell me what was happening and describe things to me and say, hey, can you just tell me what you think? What would you have done? And that made me feel, like some of that was still, close to my heart. But this quickly overshadowed the stresses for me that came with that. But, Bobby, I will tell you what did happen to me along those lines. That was probably the hardest thing that's happened to me is in this pathway that I've chosen, is losing my identity as an equine veterinarian.
Gotcha.
And I still see myself as an internist criticalist, but the folks here at Texas A&M, I don't work in that capacity. I was hired in here into the administration. I teach a lot in the preclinical program, and I have wonderful colleagues, in the large animal clinic, but that's not how they see me. That's not how the college sees me. And so that was one of the hardest lessons for me to accept, is that I had chosen a path that took me away from everything. I gave everything in my life for so many years. And you guys know what that's like when you achieve, those board certifications and and you're writing and you're publishing. And it was really hard. I don't think I realized how hard it was going to be to give that up.
Yeah.
And so, I still have, there's still part of me that regrets losing that clinical piece. It gets smaller and smaller as more and more things build up this other part of my life. But no, I certainly, it's nice when you, obviously, Catherine, now with your administrative role, you can't ever completely turn your phone off but it's much different than not having
Mhm.
being connected to that emergency line or your clients, you know, in that capacity, or your patients in the hospital. It's a very different sort of stress that I navigate with the path now that I've chosen.
Well,
That's
thanks
a-
for sharing that. I appreciate the honesty, like that you
Yeah.
are giving something up, and that's something
Yeah.
that I wrestle with sometimes. The more you shift in one direction, you're like,
Yeah.
but you know, there's this part of it. And so it's nice to hear, like, that's normal. Yeah, you're going to feel that.
I
That's
I'm
truly
sure there's
think
a lot
it
of
is.
people that listen, you know, that are listening that are thinking the same thing or struggling with that same, you know, you can only wear so many hats.
Yeah. And
Yeah.
I'll reiterate that, you know, I worked with Julie Hunt on her CIVME project, which was looking at veterinary educational researchers as part of that. And the 6 educational researchers that were interviewed for the article that we ended up writing, expressed that very same thing, right? This idea that they, a number of them were very emotional about disentangling themselves from, you know, sort of the clinical side and choosing that path and that divergence. So it's really interesting to hear you talk about that, Kristin. But I will say, as somebody who's not board certified in any kind of veterinary specialty, I chose to go down the route of immersing myself in the education world. And so for me, there is no, I mean, I do occasionally miss the clinical practice as a GP kind of situation. And I do, you know, I have the same kind of thing where people will occasionally call me and ask me. And so that keeps me connected. But I was not happy in clinical practice, and I am so much happier in the classroom. And that's, so my passion is in education, and it always has been. So I get filled by that. But I can certainly see that if I was like forced someday, you know, somebody was like, you're never going to work in academia again, you better go back into clinical practice, that how a piece of my identity would be kind of stripped from me. And I would be really, really sad about that. So I can definitely appreciate that. But I think it also goes both ways. So
Yeah.
For sure.
Yeah. Thank you.
You know what it makes me think of is like professional identity formation. And we
Mhm.
think about this a lot with our veterinary students, but it's interesting to me to think about now the people who've gone through like residency training and then become clinician educators and then become like administrators and educators, like what their professional identity formation as educators is, how different that might be for someone who maybe doesn't get a DVM, right, and comes into veterinary education from the pure education side, and what their kind of identity is. Because yeah, Kristin, I really identify with that. I haven't had that experience myself, but thinking about the prospect of, you know, not being an anesthesiologist anymore, like as it is, I kind of have to dig to find research projects for my residents and to present at the anesthesia conference, because all of my research is kind of teaching oriented.
Yeah.
So yeah, it is definitely seems like a struggle.
seems like it'd be a great qualitative research project.
It does, doesn't it?
Put it out there for
Yeah.
y'all if you wanted to do that with me.
I think we formulated a question.
Yes, we have.
Oh, goodness.
Cool. Well, thanks for that. And then so you mentioned when you started at SGU, you know, you didn't really know very much what was happening. You didn't have any training in, you know, teaching and creating syllabi and this kind of thing. But you had a good partner, it sounds like. So in all of that process, what did you feel your greatest single challenge was, I guess?
I think the greatest challenge when I started was recognizing that I was not training residents. And it did
Oh,
not
yeah.
matter. It did not matter. And in fact, if it was something that I thought was cool, it did not belong in the preclinical program.
Yeah.
Period. End of discussion. I mean,
Yeah.
it doesn't belong. And so I think backing up and recognizing that you can't teach everything you know. That's not the goal.
Mm.
Your goal is to find a handful of things and to really develop confidence in your learners so that they can ask questions, they can find answers, and that they're excited to get more.
Yeah.
And so I think backing back enough that you can really deliver an experience where they feel like they can take away something and describe it to a parent, a friend, or a colleague at another school or even in another class, I feel like I've done my job. And you know, when you get somebody to come over to the equine side that had no idea about horses, you just feel like, oh my gosh, yeah, this is great. But I think that that was one of the biggest things, is recognizing that I could pare away without losing the opportunity to teach.
Yeah.
And I think that that's the biggest struggle that a lot of new teachers have, is trying to fill up that 50 minutes, and you can't just talk faster. And it just doesn't work that way. So you need to just probably stop, cut 30%, and then start backing off from there. And it took, after and the nice thing about SGU is that it's taught on semesters. So you get almost immediate feedback on how you're doing, and you can revise very quickly in time to get started again, because you're teaching the same class twice a year, or classes twice a year. So it's really a beautiful thing versus, we have a wonderful peer reviewed teaching program here at Texas A&M, and faculty have opportunities to teach typically in one semester the next, and then they have to wait a whole another year to have an opportunity to teach that same thing and maybe get evaluated as a peer observation in that same capacity. And it wasn't like that there. And that was really, really helpful, trying to get that in the moment feedback from my students to tell me how I was doing as I was growing as an educator was really, really helpful. And honestly, that catapulted you into the spectrum of, you're not just doing this once a year. So you have to be in academia for 9 or 10 years before you feel like you've really got some things under your belt. It happens very quickly when you're rolling that way, in a twice a year curriculum like that.
Yeah. You know what? I'd never thought of that, but you're right. Like, and it's going to be more than doubling the speed, because like you said, there's that recency to it. You're like, I just did this and now I'm doing it again. And as we all know, when it comes to learning, repetition is really important.
Yeah.
So from an educator, and to learn that, that would be amazing to get to try things. Although I can also imagine the flip side of that being kind of frenetic, like, I have all these things I want to do. And we just ended one and now I'm starting again. But that's really when I hadn't thought of.
It's funny too, kind of along those lines. And this happens to me even now at Texas A&M, because I teach in all 3 years of the preclinical program. You have to figure out who your audience is, because I might see first years, then third years, then second years, or in any random order in one afternoon or in one day. And so you have to figure out, who am I walking into this classroom? Am I the rah-rah cheerleader? These are first year students. Everything's okay, that you can do this. This is so much fun. To third years, where you start clinics in 2 months. There's no reason that you can't have this conversation with me right now. And then the second years are, hey, remember, we've done this. Don't look like we don't know what we're talking about here. We've had this conversation before, so let's get on the bus together. And so it's really important, I think, when you're teaching in the preclinical program, to really know your audience, to know where they've been and where they've come from, so that you can approach them at the right level, and bring that knowledge with you. Because I think that having that inherent accountability in a program within the curriculum as far as sequencing is really important to help your learners. And that's really important, I think, as educators, for you to spend that time understanding what they've had before, so that you can meet them where they are. I think a lot of times there's opportunities lost because we spend too much time redoing things that have already been done, rather than meeting them at the starting point and then progressing on building. Yes, exactly.
You're obviously a natural educator, because you've said many things in that last few minutes that a lot of people who've been teaching for 20 years, they either refuse to learn or they have not picked up on. And one of the things that I talk about a lot is this idea that, anybody can walk into a room and call themselves an educator, but the flip side is not everybody can walk into a room and call themselves an engineer or an architect or a veterinarian, right? Because we just assume that there's additional training involved with that. And personally, I think educator is probably the second hardest job in the world, next to parent.
I was like, what's number one going to be?
Yeah, because it's so complex. There's so many things you have to think about. It's not just about transferring knowledge to people. It's reading the room. It's understanding if you've lost them. It's understanding that there's a group of people over here who aren't willing to speak up, and how are you going to get to them and get them to sort of share in their brain where it is, they are and how they're going to manage that. But then also making sure that you're not losing those people who are ahead, and making sure that, everybody is sort of coming out where they need to come out. So I think that's great. And then the other thing I wanted to point out is this, I wish you would come and give like some kind of mind bending mind merge to all of the educators out there in veterinary education who had not yet figured out that sometimes you just got to cut stuff out. They're not teaching residents, right? You're teaching students who are going to graduate and potentially become GPs and just need this first year knowledge. And we appreciate the passion and that you know so much, but sometimes they're the worst teachers because they can't remember that, that's not where we're supposed to be teaching them. So thank you for that. That was awesome.
I have a follow-up question on that there that I've been thinking about. And so this is for you, Kristin, but also Catherine, Eric, if you guys have thoughts on this. So, I mean, I remember when I first started and, I was like, can we talk about the cell-based model of coagulation? Right? Like that, because I'm like, this is so fascinating. Look at how cool this is. Look at all this stuff. There's so many more arrows than you were aware of. And obviously that's just like, it's asinine to think that that's what, but that's what I would get excited about. And I've had to learn to get excited about, and I am now, like, how do you breathe? That's like one of my favorite questions to ask students, like, let's talk through this. And so I'm excited about teaching those things now, because I actually think it's really fascinating to get down to the basics. But have any of you guys learned over the years of working with kind of new faculty who are maybe fresh out of a residency? How, that's our natural tendency, right? Is to be like, but this is the stuff that's so cool and I'm excited about. How have you figured out a way to kind of more quickly, maybe than it took me to figure out on my own, get them to, no, you are not training them to be, to replace you at this point, right? We're training them to be day one veterinarians, that graduate, go out there. And then maybe you can, share little tidbits here and there to get them excited about stuff, but that's not really your goal. Have you guys learned any tips or tricks to kind of help people see that and say, I know you're passionate and excited, and that's exciting. We love that. But we also, maybe the cell-based model of coagulation is not appropriate to talk to, second years about. Just saying.
Kristin, you want to take that as our guest to start that?
Oh, sure. I don't want to sound condescending to folks that are not veterinarians, but a first-year veterinary student is just like a client.
Mm-hmm.
They don't know much more than a client. They are taking physiology and anatomy. And I feel like when I'm teaching first-year students, it is my job to bring to life physiology and anatomy. And I'm going to try to take renal failure, for example, and bring it down to a first-year student who's teaching or learning about renal physiology,
Mm-hmm.
and giving them clinical examples of why it's important to be able to draw a nephron for your client and describe where the injury is occurring and why we need to provide X amount of treatment or supportive care. And so I think that trying to have them understand how to bring to life foundation science on a daily basis is really, to me, what helps students understand why they're sitting in class. And maybe the coagulation cascade in that great a detail with all of the arrows is a little bit too much, but I often come back and say, get them to remember their histology. Drawing a diagram for clients is really helpful to get them on your team. They have to become part of the healthcare team, right? And the biggest way to have them and to sell your advocacy and to have them join the team and to be compliant is to have them understand and buy in. And so I think, it is hard for a lot of our junior faculty that are just coming out of residency to remember what it was like to train with that general practitioner or to shadow. And so I think, bringing things back to preventive care, that was also one of the really, really challenging things for me was teaching myself. I had never worked in equine practice, in general practice. I'd never done a dental exam. I just didn't do, we had people, that wasn't why horses presented for emergency, right? They might've fractured their jaw. That's okay. But, learning about vaccination programs, learning about deworming programs, and, all of the research that's out there to support preventive care. Those are things that are really important, again, for bringing to life that foundation science of why we teach preventive care. So I always try to talk to junior faculty about bringing it back to the basics. And if you can do that, and if you can connect things from clinical pathology for students, if you can connect things from anatomy and from physiology, they're going to make those connections for why what they're learning is relevant and how this applies to them in their daily practice. And again, just using that, if you think it's cool, it doesn't belong here.
Yeah. I think you got to make the other things cool though. Like find the cool in those.
Yeah. Like how do you breathe?
Yeah.
Like,
I-
why do you
helpful.
breathe? Why do you not have to tell yourself to
Yeah.
breathe?
Yeah. Yeah. Or like, I love asking, like, what is the CRT? Like everybody can recite. I was like, okay, but what does that mean?
Yeah.
Okay, capillary, what does that mean? What do you do? You know, I've gotten to where I love talking about like those and they look at me like, no one's ever asked us this before. And I'm like, I know, but I want you to know this. And then
I want you to, write me an equation for cardiac output. Tell me how these things change. What if one changes? What does this do?
Yeah.
And then clinically, what does your patient
Why do we
display
care?
when one of these things
Yeah.
changes?
Yeah.
You know, those are the things that get them excited, because then they're going to be looking for that in their patients, right?
Yeah.
I'd love to hear your thoughts on that, Eric.
Yeah, I was thinking about that as Kristin was talking about it, because God, that would be amazing. I don't know if I don't think it just comes with time, right? That there are some people who have been teaching for 20 years who are still, doing esoteric stuff. I do think that time helps, or maybe it's kind of like, it's not practice, but it's purposeful practice. So maybe, reflecting on your teaching and being like, okay, do they really need to know this piece of information for what they're going to do? Maybe if you interrogate that on a regular basis, you'll be able to trim down. At least that's what I've done over the years, that I pause and reflect. I'm like, okay, they probably don't need to know about this, so I'm going to cut that out of, when I'm talking to them about things in rounds. So, I mean, I think that there is a part of a time component there, but there's got to be some sort of internal, like, curiosity and checking of yourself to begin with, I think. And I don't know what we could do to facilitate that process, right? Like how we could get all the specialists on board who are teaching with the idea to pause and think about, like, what do they really need to know? And then arguably, and I think that Catherine's pointed this out before, like probably content experts shouldn't be presenting the content, I know for sure that there's stuff that gets taught in anesthesia that I'm like, oh, for God's sake, they don't need to know this as a general practitioner.
Yeah, Eric, I think you and I have talked about this before, because I can remember when I was in school, and because I went to Michigan State for vet school, Kristin, and I remember being taught renal physiology by a cardiologist and being like, yes, this is what I want. I want that. That's what, even as a vet student, I remember sitting there thinking like, this is what I need to know. And then being taught cardiology by a cardiologist and being like, no. And like, why to this day, I know what Eisenmenger syndrome is. I have no business knowing what Eisenmenger. I've never seen it. I just remember learning, I had test questions on it and I still know what it is. And what a waste of time, like what a waste of space in my brain, because the cardiologist was teaching cardiology. When the cardiologist was teaching nephrology, 2 thumbs up. So I tend to agree with you there. Like from an administration, maybe it's like, no, I know that's what you really love, but you're actually not going to teach that because you're going to go off on tangents that the students don't need to know. Maybe there's something to that.
Yeah, I do. I mean, I think Bobby's question too about how do you get excited about the stuff that's a little bit more mundane when you have all this amazing knowledge running around in your head. That's what really gets you excited. I think there are ways to do that. But it can be challenging, right? So I remember back to my days of teaching MPH students. And one of the things that I would always challenge them to do is every semester, there'd be at least 1 or 2 exercises where they'd have to describe something to their family member or their grandmother or, the person off the street. And they would have to use language that person would understand. And so I think sometimes having people do that, especially if we were doing peer observations or something like that, having an opportunity to quiz that particular instructor. And I would do that sometimes when I was doing my one-on-one mentoring as well. It's just like, okay, well, you were talking about all these things, but I'm a pretty educated person and I didn't understand a word you said. So, if I didn't understand it, do you think that your students understand it? And how might you go back and explain that in a way that your students would understand it? And maybe they're not excited about the topic, but they may potentially be excited about the challenge of figuring out a way to deliver that topic in a way that their students then better understand. So it's maybe just approaching it in a way that's a little creative and not being like, oh, you're going to have to teach this really boring topic. And so it's really boring. But what are things that you can do in your teaching or in the way that you get your students to engage with it that might be more interesting and sort of helps you stay excited about it, even though you're not excited about the topic itself.
Thanks, guys. Thanks for indulging my question.
No, I was going to ask exactly the same thing.
Oh.
And I think it was something Catherine said, that if we could just get every veterinary faculty to cut out stuff, that would be amazing. That would revolutionize veterinary education overnight.
Kristin, what'd you say? 30%? Is that the magic?
That's the start.
At the
Yeah.
first
You know,
time.
I think that's just the first hack at the stack of things. And then, you know, just really, really trying to come up with a realistic set of goals for the students for that time that you have with them. You know, because I think so many times we get so excited about an opportunity to be in a situation where we can help educate that we oftentimes overshoot. And when you overshoot, you miss that teaching opportunity, that learning moment. Because if you push too hard, or you go too fast, or you go too far, you've missed an opportunity to really drive home things that will stick with them. And maybe that just comes a little bit from experience. But I think that it's you have to be confident enough to cut, and to just let that material go, and to still believe that you're going to give them lessons that will carry them into the clinic and into practice, and that will support them. And I think that takes folks a lot, because especially since we're not taught anything about education, we only know what we experienced sitting in those seats, right? When we were in vet school. And I tell you, I think a lot of the things that I do, and that I believe, and that I feel, come from a place of me feeling insecure when I graduated from vet school. You know, how would I have felt better? How could I have been more intentionally forced to make connections? And so, you know, and that was on me. I mean, I take full responsibility for what I did not take away. So totally on me. But I have really dedicated my life since I graduated from vet school in taking every opportunity that I can to help intentionally force a connection between basic science and clinical medicine, because I didn't do that enough. And it forced me to have to learn so much more on the fly, and I just didn't feel as confident as I knew I could. And I think we're doing a good job here at Texas A&M. We do have weekly sessions with our students, critical thinking sessions. They have 2 hours a week where teams of faculty get together, their basic science and clinical faculty members together, that, you know, bring concurrent and previous science information into activities and exercises to really demonstrate the applicability and the relevance of that particular content stream. And we just try to integrate horizontally content discipline as well as vertically. And I think that really has shown students, number one, the importance of them being accountable for the information, and number two, how they really can see themselves using what they're learning in vet school in their careers.
That's great.
Yeah. I think I might argue with you taking 100% of that accountability
I was thinking that
on your shoulders. I mean, I certainly think the majority of it, 80, maybe 85% of that, is certainly our responsibility as students. But I do think that there's a responsibility on the faculty member and the team as a group of faculty to do exactly what you just said, which was to help those students figure out how to integrate it. Because honestly, especially in the first year, I mean, that fire hose analogy is so apt. That's why we use it, right? And if you're a student who's just trying to keep your head above water, the last thing you're going to be worried about is how you can connect things, because you're just trying to pass the next test. So
That's true.
Yeah, so I'm going to try to alleviate that burden on you.
Well, thank you. And, you know, honestly, I think too, it's really hard, you know, to convert the veterinary student mind. They have been scraping at every single thing they can to get that grade, because they've got to be competitive. And, you know, it's just, you learn and you put that aside and you move on to the next thing, you put that aside, and there's these, you know, you just got to get to the next level. And so we really try to talk about, this is no longer your physiology course or your anatomy course. This is your content. And so, you know, we hear and we read in student evaluations of teaching, well, I didn't know if I learned this in my integrated animal care course, or I learned this in physiology. Who cares? I think we've done our job. Just answer the question. It's not different information because you learn it in one class or the other. These faculty get together, and believe it or not, they talk, folks. And so I think that, you know, sometimes I chuckle a little bit because it's happening and it's working for us. But I think we have to continue just to push it, that this is you've made a decision to do this, and we're going to help show you how. But from today, everything you learn is going to apply to what you're going to do for your life. And so it really is incumbent upon you to figure out how to use this information, and we're going to help you, but it's important.
Yeah.
You get to vet school, there's one class. We just have different segments of it, right? It's all vet ed.
It's just one class. It's vet school.
I went to vet school at Texas A&M, and one professor whom I actually did not like very much, but said the one thing that I think I've quoted more than anything, which is somebody had raised their hand and asked that age-old question of, is this going to be on the final? Yeah, right. Of course it's going to be on the final. This is your life. And his comment was, listen, life is cumulative, and so is this class. So just be prepared. Yeah. That's the way it is from here on out. And I thought that was a pretty good line.
Yeah, I love it, because we have turned a little bit of a corner. Now the question is, are there outcomes for this session?
Oh, good.
Oh yeah. And they want it, because that's what they're studying from.
Yeah.
We're not saying, is it going to be on the test? If it's part of the outcomes, that's the way you study. And so we're getting there. Yeah. And the students, they get after faculty. If they don't have their outcomes, they have outcomes for the course, but then they want session level outcomes as well. So I think we're getting somewhere.
All right. When they start critiquing verb tenses and things,
this is not
how is that measurable?
This is not a proper outcome. Can you really measure this?
Oh, that's great. That's really cool.
Yeah.
So, Kristin, what are you kind of working on now? I know the competence-based veterinary education thing has been a big part. Do you want to tell us a little bit about that, or something else that's kind of come up for you?
Well, no secret. I love the idea of competency-based veterinary education, and actually that was one of the reasons that the job that I have now was created at Texas A&M. They had the idea that they wanted to do a pretty big redesign. I don't think they had an idea at the time about what exactly it was going to be. But Kenita Rogers designed this position that would be working in curriculum development and outcomes assessment. And that's what I had been doing. I moved very quickly at SGU from just doing teaching to sort of the administrative side of things as well. And so it put me in a really good position to be able to apply for this position. And very quickly, once I got to A&M, we developed what's called the new graduate outcomes. And that document we actually did put out there in JAVMA back in 2015 or so as a way forward. Think about having a roadmap for students through a program that you can say at the entry into the program, at the end of this time, this is what you will be able to do. And we then redesigned our entire program based on those outcomes. And so the new graduate outcomes were fortunately part of the plethora of documents that were reviewed by the group, the international group that was originally assembled in 2015 by the AAVMC. There were 10 people. And as you mentioned, Catherine, I was fortunate enough to be one of those ones selected. I think because, again, I happened to be in the right place at the right time. Kenita Rogers was our academic dean, our associate dean, and was really busy with other things. And she says, well, I appreciate the offer. I can't do it, but I'm gonna offer up this young faculty member that we have here. And they took me, which was wonderful. And I was basically in awe of the brains that were, and the experience that was on that working group from the get-go. But, we all had so much to learn from each other. And it was a really, really great experience. And I don't know if you guys know this, but the reason that working group was originally assembled was to create an assessment tool that we could share among our colleges. And we quickly learned that we didn't really have anything to assess because we didn't know what we were assessing. We didn't have true outcomes. Now we had the COE9, which everybody knew about. We're all beholden to that. And, we love the AVMA for that. But we realized that, there are other things that we need to assess, that we need to, to be accountable for in our professional education. And so that's where this whole model of education was born, with the idea that we can't get to assessment unless we have outcomes. And so we really started just grabbing, human medical education frameworks, veterinary education frameworks. Harold Bach and his group at Utrecht had Vet Pro, which was wonderful and beautiful, and all of his work that he did. We just, scoured everything that was available, and ultimately came up with the model that we have now, which has those three components of the framework itself, that has the domains, the competencies, and the sub-competencies that are there as examples of the way you might use the framework, and the milestones that actually help the learners figure out how they're progressing across their clinical year, and then the EPAs that faculty can use to really have those students demonstrate those activities, and then have that be yet another way to assess. And so I absolutely love the idea of us being able to share. I believe so strongly. Everything I've ever created, I'm so willing to just give. I've done something like this in the past year. Let me just give this to you. You can use it or you cannot use it, but it's somewhere to start. And I think that is the most powerful thing for us as a group of educators, that we can have a common end goal. Because if we're all, let's say, if we all know what domain 5 competency 1 is, then we can share exercises and content and assessments related to 5.1. We don't have that right now, and everybody's reinvented their own wheel for so long. And we need to work smarter, not harder. And I think that really does come from sharing. And certainly the students want to work smarter, not harder. They want to know, what is my job? What is my end point? And I'll get there if you can just tell me how to get there. Show me what the end point is, and then give me some really great, specific, detailed feedback along the way. I think we can really, 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 just transition and elevate our professional programs to another level when we really do come together and make this a shared language.
That's great.
Love that.
That is really cool. You mentioned earlier on, making sure that basic sciences are connected with clinical sciences. And that's one question that I've had looking at the CBV framework. Is I look at it, I'm like, so we don't really need basic science departments anymore? We could just get rid of 80% of our faculty? And I don't know. But exactly, Catherine. That's one of the major problems that I see. I'm like, I don't see how we're going to transition over to this without a paradigm shift on the order of, we're going to fire half of our faculty. So I know, I've heard, I think Emma Reed at Ohio, I've seen her whole presentation on how they're doing it. But the whole time I was sitting there, I was like, we don't need all these anatomists.
Well, I'm going to argue against that. I'm going to tell you that they are incredibly valuable. And but I also understand where you're coming from, Eric. And I think that if you're a basic scientist and you look at that framework, you're like, I don't count.
Yes.
Yeah.
But the thing is that they are the foundation for everything. In fact, you can't perform a physical exam if you don't know anatomy and you don't know physiology. You can't interpret a blood glucose if you don't understand how to collect and do venipuncture in an appropriate manner for the specific patient that you're working with. And if you don't understand endocrinology, you can't evaluate whether that glucose is normal or not, or why it may be normal or abnormal. And so we had that same problem at A&M back in 2014 when we designed our outcomes. And one of the things that really helped us was using preclinical milestones. And that really, because when you bring those milestones from the clinical year and you write them back into the preclinical year, well, now the basic scientists start to see, oh, this is where anatomy, this is where physiology, this is where ClinPath lives. Oh, it's right here. It's just, you can't write a framework at the 30,000 foot view with so much detail, because now you're actually being too prescriptive to programs. Yeah. And so you have to write it broad enough that everybody can I guess customize to their local context and really be able to spread their own wings using that umbrella as sort of their guiding roadmap at the 30,000 foot view. So I totally get that. And I love, and the other thing that we've done to really bring our basic scientists on board is that they now teach not just in the first year or the second year, they're teaching all the way
Oh,
through as
cool.
well.
Oh, that's great.
So we're bringing them back into those critical thinking sessions. You're not, because here's the thing, you might teach a heck of an anatomy course, but if you don't see those students in second year and in third year, you have no idea how well you did. And so you need to follow their minds. You need to bring your content. You need to support your discipline as they go through and keep them accountable to that information. And so we've really put them on faculty teams with the clinical faculty to design these critical thinking sessions. And I think that's really number one. I think one of an unintended consequence of all of that we've done is that faculty have better buy-in about the curriculum. They know more about it. They're more willing to talk about it. They're willing to support it. They're willing to get involved because they have an idea. They have a bigger stake in it, right? And so this was really interesting when we started our redesign and we put the basic science faculty in a room with the clinical faculty. It got a little dicey. It got a little heated. First of all, we had to have name tags. Not everybody knew each other.
That
And
doesn't surprise me. Yeah.
I thought, wow, okay, this is not good. We need to be better than this. And so that was for starters. Well, then the gloves came off. And oh my gosh, I thought we're gonna need mediation just to design this thing.
Wow.
So it was, but it was great because in the end, I think everybody had a better appreciation for how things were taught, where they were taught, how we could improve this, and how we could better support our students through the program, but also the things that we're most passionate about. And as far as the discipline specific things that are important to us. So that's been really helpful here in our program.
My brain is spinning right now with lots of different ideas, but I guess the first one that comes to mind is I wonder if there would be any possibility of doing like a faculty exchange where like Bobby, if you had a physiologist that shadowed you for a day in the clinic, but then you went to their lab and you kind of watched and learned from them what they did. Just to,
oh my gosh, we should see so much of that. Yeah. So where I'm at Virginia Tech, my office, like, so the ER faculty, the clinical faculty, we have a little alcove and we're down. Our offices, for whatever reason, are where like the basic scientists are, where the researchers, the physiologists and things like that. And so like, I actually like, this is when I go to like wash my dishes after lunch and like, well, I see. And actually I just like today, one of them came to me and was like, hey, I need a thing, that they thought they could get from like the hospital, that kind of thing. They're like, who do I talk to? And I'm like, oh, so like they come to me just because my office is there. Like most of the clinical faculty, their office is in this other part of the building. And so I see all those people on the floor, so that doesn't matter. But actually I'm like, we should probably do more integration and just things like that, just having my office physically near these people. And so I interact with them more. Yeah. And I'm just like, why are we segregating each other? We should all be mixed in together. And it's amazing how many things that actually do overlap and how many things we have in common. And at a previous institution, talking with the respiratory physiologist, because I'm like, yeah, I love talking about how we breathe. Like I get nerded out about that. And so, he and I would have conversations about how we teach that and like, okay, well, what are you teaching in the first couple of years? Well, here's what I talk to them about when they're in the clinic. And so we would get together and chat about those things because they're like, I think as you were saying, Kristin, it seems like when you look at the endpoints, like where's the basic scientists, where's there room for them? But if you don't have that foundational knowledge, the rest of it's a house of cards, right? Like, oh, I can memorize or pattern recognize, but I like really what I want my students to know is the why. And you have to have an understanding of the physiology, right? How are you going to tease out why this patient is in renal failure if you don't understand how renal physiology works? And so, I think once we get together, it's really easy to see where the overlap is. So I actually love your suggestion, Kristin, or Catherine. I don't remember now who said it, but it was a group thing. And let's come hang out with me in the clinic, and I will come and hang out with you in your lab or sit in on your. Like, I think we will just start to be like, oh, it turns out
you got to establish trust.
Yeah. But I mean, how fun would it be for an anatomist and a radiologist to hang out together on rounds and, go through that and then go.
I don't know. That sounds dangerous.
No, but I mean, seriously, right? Like, so I was complaining to a colleague of mine who teaches anatomy and is like super passionate about anatomy. And I hated anatomy. I'm going to be honest with you. Like anatomy was not my favorite thing. but it was because it was the way it was taught. Right.
Yeah.
So I was taught every os and every origin and every insertion. And it was so like sort of compartmentalized into this. You just have to know this. And so I was talking to her about it. I'm like, I don't need to know how to tell the difference between a right femur and a left femur. I'm always going to have a point of, you know, of reference, you know, and if I don't, then something's wrong. And she looked at me and she said, well, I mean, if you have a radiograph that's not marked, it would be really nice to be able to figure out how to tell the difference between a left femur and a right femur. I'm like, well, crap. Why'd you have to tell it to me that way? But those are the kinds of things that people don't talk about. And I think if I'd been taught anatomy that way, maybe I would have found it more valuable and worth. So yeah, I just like, I'm thinking of you, Eric, as an anesthesiologist, how many people would benefit in, you know, the basic sciences from being with you and vice versa. So I don't know, maybe we should try to do something like that. That'd be cool.
I love the way it sounds. That's great. Yep.
I you know, when I said before, like, it's all about trust, I think that in my experience at Midwestern, the pharmacology folks taught all of the medical professions, so the DO students and the vet students, et cetera, and they kind of have like some subspecialized, you know, sessions for the vet students. But so, you know, they met with me and we were talking about, you know, what drugs they're teaching with regards to anesthesia. And you know, I had to figure out how to be really tactful when they came up, you know, with some things like thiopental and halothane. And, you know, it's like, oh yeah, like these are like really important for like historical reasons, but you know, we don't use them anymore. But it does take that step of trust, right? Like that they would need to trust me, and that conversely, I would need to trust them to be preparing the students, you know, most effectively for when they get to clinics.
Yeah.
Well, and you're right, Eric, and also finding ways to gently explain to some people who think they know more than you do that they really don't. Right. I mean, I remember I was actually doing one of my senior year externships at White Oak Conservation Center, which is a really world-renowned conservation center. And I was really lucky to be there. And on one of the days that I was there, they had a tour group of like dignitaries coming through from the Harvard Medical Program. And, you know, it's Harvard Medical School. These people are like the best of the best. And they're walking through, and there happened to be a container of guaifenesin sitting on there that we were using because we were using it as a part of a sedation protocol for one of the animals. And this physician who happens to be on faculty at Harvard Medical is like, well, why do you have guaifenesin? Why do you need a cough suppressant to help out with blah, 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 blah? And I'm standing there and I'm like, well, because it also has sedative properties when you mix it in with blah, 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 blah. And she looks at me and she's like, oh, I had no idea. And she,
you mean y'all don't use GKX?
I know, right? I was like, I just taught somebody from Harvard Medical School, you know,
that's
like
awesome.
as a fourth year vet student. So yeah, I think it's also finding tactful ways to remind them that we can all learn from each other, and it might be a nice way to do that. So
we're just being
no idea.
Not know better. They're intimidated, right? I had no reason to be intimidated.
Right.
I had no idea guaifenesin was an expectorant, and my wife is a pharmacist, and she was reading this off to me, and I'm like, okay, did you just say guaifenesin? And she's like, yes. I'm like, that's a muscle relaxant. And she's like, no, it's an expectorant. I'm like, what are you talking about? She's like, what are you talking about?
That's a riot.
Yeah.
You've clearly never taken Mucinex.
Yeah, clearly.
No.
Or you haven't read the ingredients at least.
That's right. That's right.
Too funny.
No.
Very cool.
That's great.
So do you think, so Kristin, as you were sharing kind of the process and how you got involved with CBVE, first of all, I didn't know that it started out as like, we need to figure out how to assess things. And we're like, we can't do it. That's awesome. But as you were talking and all the work that you've done at Texas A&M, it does sound like your, foundational science or basic sciences faculty and your clinical faculty do integrate a lot. And would you say that was because of how you guys approach things with the competency base that happened naturally, or was it very intentional? Like, we're going to, after our big brawl, when everybody, got together in a room, or, do you think that actually just sort of naturally flowed as a consequence of the competency based approach?
Well, I wouldn't say that.
That's fair.
Yeah, our dean at the time was wonderful, and she put up she in one of our, trying to rah get the faculty excited about this thing that nobody wanted. She said, here is a change scale, and on one end are astronauts, and they're ready for change at a moment's notice. On the other end are morticians. They don't want change. No change.
That's fair.
And then here are the academicians on the end with the morticians. They just can't, it's just so hard to impact and to effect change. And so I think what happened for us is we knew, and from the I'm talking about those on the curriculum redesign planning team, we knew that the only way we would have our academician scientists go for anything we did was by using evidence. And so we collected about 18 months worth of data. So we had our new graduate outcomes. What we did was we surveyed all of our stakeholders. So our current students, our recent alumni, our practitioners that are constituents, our employers of our graduates, our faculty. We surveyed everybody. We wanted to know, are these outcomes relevant? Are they, how often do you use them in practice? What is your experience with our graduates? How do we make them more marketable? We collected all this data. And then what we did was we put faculty into teams. We called them basically our analysis teams. And we had them analyze, and so the redesign planning team, we had focus groups of employers, we had focus groups of students, we had hundreds of hours of focus group transcriptions that we processed, that we paid all kinds of graduate students to do this work, and then we analyzed and we processed and we summarized and got everything ready. We had notebooks that were yay thick that our faculty analysis teams reviewed. And so we had them review in teams the first year, the second year, the third year, fourth year, and really decide what could go, what needed to stay, what related to the outcomes, how impactful are these things, what was said about courses that were positive, what were things that were negative. And then ultimately the curriculum committee, all of this went to them, and they were interspersed in all of these groups, of course, but ultimately they said to the redesign planning team, come up with 2 different frameworks for us. And we will then talk amongst ourselves, and we'll go to the faculty, and we'll come back and we'll make a decision. So really the real gloves came off when we started cutting credits. Because what we found is that there were things in our outcomes that were not in our curriculum. There were things like personal and professional wellness. There were things like financial literacy, things like communication. Turns out communication can't be an elective.
Shocker.
Turns out preventive care can't be an elective. These are things people do every single day of their lives in this profession. That has to be taught from day one through the end of the clinical year. That's the only way forward. And so we had to find the credits somewhere. And unfortunately, the basic sciences are where they came from. And that was a hard pill. And so we looked at our, our constituents as far as veterinary programs, and how many credits of anatomy do you guys have? How many credits of this? How many credits of that? And I mean, no, it was a lot, because honestly, I talked about losing my identity when I transitioned away. And when you have a course that is yours and it no longer exists as a silo, who are you?
Grieving process.
It is a grieving process. It is a grieving process. And if you, as part of the administration, or you're part of the group that's leading this, if you don't understand these emotions that faculty are going to go through, it's going to be a hard road. And so it really was so important for us to channel all of these feelings into something where we can say, yes, your course is going away, but not the content. I mean, turns out we don't need 5 credits of parasitology. Turns out we don't need 5 credits of toxicology. Turns out we need to find out what the top 25 toxins are, and we need to teach the heck out of them. And do it really well.
So waited to go to vet school.
Well, I know. I'm telling you. And this is because these are things that I took away from my vet school, and I was like, we can't do this anymore. So these are the things that we reached out and we gathered information. And so at the end of the day, the curriculum committee decided on a new framework, which was very integrated, both horizontally and vertically. We designed new courses. There were only maybe 2 or 3 courses that remained the same from the previous program, credit wise, and content wise. Most everything else we redesigned, and just really it became a team effort. So we put teams together. So for instance, when we redesigned anatomy, large animal anatomy, the content was cut considerably because it turns out they don't need to know all of the venous and arterial supply in the chest of a horse.
Yeah.
They just don't. They need to know they need to know intricately what happens in the distal limb, but not all this other stuff. And so we even asked our practitioners to come in. We had workshops where we looked at content to say, is this core? Is this species specific? Is this elective, or does it not belong?
Yeah.
And, I can remember kind of getting into a heated argument with one of our theurgenologists about the histology of the vas deferens and how that was bloody well core. And I mean, it was a lot, but that's the passion that people have for their specialty. And, here we've got general practitioners saying histology, the what? I mean, honestly, that's kind of how it went. And so it was really, really, really eye-opening. And so we just collected so much data, and we really felt like at the end of the day, we did our due diligence so that the decisions that we made came from a place of concern and a place of recommendation and revision that were suggested by our stakeholders and not by the group that was running, the redesign. We were merely there to process the data, help the curriculum committee and the analysis teams sift through it, help summarize, help provide the curriculum committee with options. They're the ones that made the decision, and we move forward. Once the decision was made, then we formed those teams, and that's where we put faculty both, from preclinical and clinical in the same room to redesign courses to come together and build activities and exercises. And that's really where it got to be a lot of fun. And, there were so many scholarship of teaching and learning papers that came out of that, faculty working together that didn't even know their names at the beginning of this. And there were just so many unintended consequences. It were just such a great experience for a lot of folks. But that's not
growing pains.
Oh my gosh, that's not to say that you don't need to have incredibly thick skin and wear your coat of armor every day, because it is not going to be fun for a while.
And I was going to say, it's not going to be quick. That was a long process for you.
I think that it's not going to be fun for a while sounds like a good line to end on. You guys are okay with that.
Yeah, but it will be ultimately something that I think everyone can be incredibly proud of. And when your students start talking to you and you have people from the community starting to comment on your graduates, and that means a lot. It means a whole lot. So you feel like, maybe this is paying off.
Yeah, that's amazing.
Great. Well, Kristin, thank you so much for joining us. I really appreciate it. Sorry, my internet was too slow to be on video, but we'll have captured it. Catherine, Bobby, any final words from you?
I just wanted to say thanks for joining us. It was awesome. Really.
We'll have to have you back, because I could listen to more of your stories.
You guys are too much. It's wonderful to see you, and thanks everyone. Please take care and stay safe out there, and I'll look forward to the next time we get to visit.
Same to you.
Wonderful. Thank you.
All right.
Bye.
Thanks everyone. Bye-bye.